Hello, Dr. Yazdani. Thank you so much for offering this incredible opportunity for our Club Med Virtual members. My name is Mariana, and I am the event spokesperson for Club Med Virtual. I will be leading today's session, reading any comments posted in the chat, and facilitating the conversation as we go along. Before we start, I want to remind everyone to maintain proper etiquette and please keep themselves on mute unless Dr. Yazdani specifies otherwise. If you have any questions, please post them in the chat and we will address them as we proceed through the session. A Google survey will be administered for Wayne State University students at the very end of the session to verify your attendance and will close 30 minutes after the session terminates. Please stay on the call for at least 5 minutes after the session is over to ensure that the survey is working for you. This session will be posted on YouTube in case you are unable to attend or want to revisit certain topics that Dr. Yazdani discusses today. But you cannot receive shadow or attendance hours if you are not present in this call and complete the survey. All right, Doctor, you can share your screen if you'd like and get started.
Let me start. Let me get, okay. And let me just get the laser pointer. Okay. Hi, everyone. I'm Dr. Yazdani. And if you were here before, you'll know that I went to undergrad at Bryn Mawr College and GW. And then I went to dental school at Columbia University in New York City. And I graduated with an MPH and a dental degree. I graduated in 1997, so I don't even know how many years that is. I'm scared to say how many years I've practiced, but I've practiced at the beginning of, I used to teach also. And then I took 5 years off after my third child was born, but then I went back to it. So I've been basically doing it since 1997 with a little 5-year break. I have a private practice in Vienna, Virginia. I work full time, and I also have a lot of hobbies on being on different boards. So I'm on a board of Project Turquoise, and I'm one of the founders. We help refugees or displaced people around the world. I'm on a board of the Iranian American Community Center, which is a group for both Iranian Americans in the Washington, D.C. areas and the outside community where we provide community services. And I'll get started. So I know a lot of you are dental students and some of you are pre-med or pre-dental. So I think this talk will be really relevant because I mean, there's a lot of debate too, and I've never understood why dentistry is not a subspecialty of medicine. And I think if it was, then we would have a much better handle of our health system, especially when it comes to prevention. But somewhere along the way, it became its own specialty and became a separate specialty. And unfortunately, you'll see if you do end up going to dental school, a lot of times when people end up in the emergency room with dental emergencies, physicians don't know what to do. So it's really, it's too bad. But anyway, what is oral health? I took the World Health Organization definition. You guys can all read it. It's a state of being free from mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal gum disease, tooth decay, tooth loss, and other diseases and disorder that limit an individual's capacity in biting, chewing, smiling, speaking, and psychosocial well-being. So maybe you guys have been to dental appointments and you didn't think all this was involved in oral health, but there's a lot going on. So there is a strong link between your oral health and your systemic health. And Harvard was the first one that found the connection between your heart and gum disease. So some people think dentistry is something luxurious. It really isn't. It should start when you're very young. I don't know if you know this, pregnant women who haven't had a cleaning for a long time have gingivitis or gum disease. They actually are prone to high blood pressure and preterm labor. So there's a lot of things going on in your mouth. So a lot of the preemie babies are connected back to people with very poor oral health. And you have to remember that like your mouth is the gateway to your body. So things can enter your bloodstream through your gums because you're very vascular. Obviously, when you eat, you can enter bacteria to your digestive system and also your respiratory system. So you have lots of ways. If you don't have a nice healthy mouth, you can negatively impact the rest of your body. And in the first example, because gum disease and heart disease was like a huge, one revelation. Once they discovered that, they realized that especially people with valve disease or other heart disease, like they have to have their dental health. And like these days, they won't even let you get valve surgery if you go to a cardiovascular surgeon unless you get a dental clearance. So it shows how the bacteria from the mouth enters a bloodstream, then it sticks to the plaques and we get blockage. And they've actually looked at plaques and same exact bacteria as in the mouth for periodontal disease. So also a big cause of strokes. And again, it causes basically inflammation and a blockage. So then on the right here, you'll see the different, and there's so many other things, but you'll see connection of different systemic diseases with your oral, with gum disease. And I'll tell you, like, as far as diabetes goes, especially diabetes type 2, a lot of times the dentist is the one to diagnose you, because you'll go to the dentist and, we take our x-rays every year and all of a sudden we'll see unexplained bone loss in someone's mouth. And we'll be like, we'll go through all the causative effects. Do you smoke? Have you smoked more? I mean, we'll go through poor oral health, but most times when you see it suddenly like that, it means that their sugar levels are so high and they probably have diabetes type 2 that hasn't been diagnosed. So there's a lot of things you can tell from people's mouth. I don't know how much you guys know, so I always put a little anatomy of a tooth so you just understand. So this outer layer is the enamel, and we kind of think of it as an eggshell, what protects your teeth. And then the second layer is your dentin. And the third layer is where you have your nerve and your blood supply. So if anyone in this group has ever had a root canal, most likely the bacteria started in the enamel, it spread to the dentin, and by the time it hit your nerve chamber, you had no choice but to get a root canal and remove the blood supply and the nerves, which obviously we don't want to do that because that's a dead tooth, but we get to save the tooth. But now you have a necrotic dead tooth, a weaker tooth that's brittle. So I just wanted to give you, so you just understand the anatomy of a tooth. Okay, healthy teeth and gums. We said that a lot of bacteria can go from the gums to the rest of your body because your gums are so vascular. So healthy teeth and gums, pink, firm gums are what we're looking for. Then there is like the beginning of disease where you'll see a little inflammation. If any of you have bleeding gums when you floss, know that you need to go to the dentist soon because gums should never bleed. And if they do bleed, you should be flossing them more. I know a lot of people will be like, my gums bled, so I didn't want to floss anymore. The floss didn't make your gums bleed. Your gums were inflamed. Nice, healthy gums will never, ever bleed when flossed. And this shows advanced disease where the gums have recessed where I'm pointing to. And you see, again, a lot of inflammation in the gums. And this is where you start getting loose teeth because you start losing your attachment apparatus, which is your bone and gums. So are they allowed to stop me for questions or do we wait till the end, Mariana?
They're allowed to ask questions in the chat. So I
Okay, in the chat. Okay, so you'll let me know if it's in the chat in case I miss it. Again, I wanted you guys to learn how to read x-rays. What are x-rays for? What do we see? So you see this little thing here, it might look like nothing, but I mean, x-rays should only show bone. So when you see this in a tooth, it means that person had plaque that's calcified now and as attached there. That's how long it's been there. And calcified plaque is a big sign of having disease in your mouth. So all this is bone loss. So bone should be up here. Look at this, bone loss, bone loss. All the bone should be up here at the gum line. And this is a person with a lot of bone loss, as you can see. If you want to see cavities, this is a cavity here. And the enamel, you never ever have to drill it unless it goes past the enamel to the second layer. Because what did I teach you? Here's the nerve. So by the time it spreads to the nerve, you have to do a root canal. There are no root canals here. Here's another cavity at the root. When you see someone with this kind of cavity, root caries, you think, oh, they have a dry mouth. Why do they have a dry mouth? Are there certain medications they're taking that's causing that? So this person has a lot of problem. Thankfully, that's none of our x-rays. So, oh, and the white are metal fillings. You know, the old silver amalgam fillings that your mom or someone else or dad might have in their mouth. That's why they show up as white, because they're radio opaque, they have metal in them. This is the new tooth color fillings, where now you can actually see them. At the beginning, they didn't put any quartz or anything in them, and they wouldn't show up on x-rays, but you can see the difference. This is pure metal, and this is just, they've added some quartz to make it white. So I think that your oral health is really important for your general health. And like I said before, I see it as a window gateway to your body. And also, when you have infections in the mouth, it can increase a risk of infection elsewhere in the body. But more importantly, also when you have other diseases in your body, it can affect your mouth negatively too, like we talked about the diabetes. So now, having said that, oral health disease is so widespread, but it's also very, very preventable. With good preventive care, you can prevent a lot of oral health. Now, why is that important for your general health? Because later we're going to learn that a lot of the risk factors for your oral health are actually risk factors for your general health. So if we get in there early and we teach people how to have good, healthy mouths, we're actually setting them up for a lifetime of being healthy overall. And that's why I think that connection is so important, and where your oral health can play a big role in your general health. So again, here's another study they did in Finland, where they took 75 patients who had strokes. And when they examined their mouth bacteria, 79%, that's almost 80% of the patients had the similar bacteria. So that study gives a huge indication that just bacteria in your mouth has a huge link with strokes. You can look that up. It's going to be in my, okay. Why do we want oral health from the very beginning? Because I already told you, when women are pregnant, if they have bad oral health, right there, they can affect the child with a preemie baby by just bacteria in the mouth. Basically, it's called pregnancy gingivitis, leads to high blood pressure, leads to premature babies. Infant, it's so important to educate parents at the beginning. There's something called baby bottle syndrome, where basically they let the baby sleep with the bottle and they get all rotted teeth. I don't know if any of you have seen that, but that affects a child a lot. First of all, it's also they're very embarrassed going to school with black teeth. So it really affects their confidence, but also affects their health, that they have abscessed, infected teeth. And we already learned that you are so vascular, so you're sending that bacteria all to the rest of the body. Childhood and adolescence, same thing. Teaching kids the importance of good preventive care, going to the dentist every 6 months, doing their work at home, brushing, flossing, using fluoride. If anyone's anti-fluoride, we can have a whole nother talk about fluoride and the importance of fluoride. And then obviously adulthood, because as you become an adult, you're more prone to other illnesses, and you want to make sure that you're not adding bacteria from your mouth. Cost of oral diseases, and you can just see here, diabetes is the number one, sort of taking all the healthcare dollars, but oral diseases are number 3. So we have diabetes, cardiovascular diseases, oral diseases. Well, guess what? Cardiovascular diseases, high blood pressure, high cholesterol, and diabetes type 2 are not 90% preventable. They're 100% preventable. If you know someone with diabetes type 2, with the right diet, they can reverse it. The same diet that will give you a healthy mouth will prevent these diseases. So look at all the money we'll save in healthcare around the world if we start giving early dental care, because we're not going to give early cardiovascular care and diabetes. This is the end game here. But we start early here with the oral health disease. Look how much we save in healthcare dollars. I mean, even it's surprising. Look at cancer. It's the 5th, 6th. Yeah. But look at these three: chronic diseases that are preventable. These are not preventable. The common risk factor approach. So this is something in public health, and I really want to educate both physicians and dentists work together, because look at the common risks. Your diet puts you at risk of obesity. Obesity puts you at risk of cardiovascular disease, high blood pressure, diabetes type 2, cancer, lots of disease. Your diet affects your cancer. Your diet affects cavities. What's the number one reason for getting cavities? A poor diet, high in sugar. And sugar also causes diabetes type 2. It also causes obesity. So right there, if we as dentists give good nutritional advice and care to our patients, we're helping them prevent these other problems as well. Stress causes heart disease. And believe it or not, stress causes gum disease. I have patients that will go get a clearance from me, and then this is a true story. They'd go to Iraq or something with the State Department, and they'd come back with abscesses in their mouth. So stress has a huge impact also on your oral health. And hygiene. So anyway, if you look here, it shows all the risk factors and how how these are all related. Let's go to the next one. How am I on time? Okay. So I'm going to go through some of the major risk factors. Tobacco. How does it affect your oral health? It causes oral cancer. It causes lung cancer, which usually comes from oral or linked. Painful lesions, and you have a bigger chance of infections. Periodontal disease, which is basically gum disease that we talked about before, and losing your teeth early because it causes bone loss. Same thing. Tobacco, what does it have on your general health? It causes cancer, coronary heart disease, stroke, respiratory disease, and diabetes. So here's a common risk right here. A lot of dentists, and now they're even letting you charge for it, will be advising their patients in smoking cessation because of the risks on your oral health. Alcohol. So again, alcohol can cause oral cancer. It's actually the number 2 reason for oral cancer in the mouth. Smoking is number 1. It can cause cavities because it dries out your mouth so much, brings your pH down to like level 2 when the ideal pH is 7 to 8, a neutral pH, excuse me, and causes massive caries because of one of the things, like we tell you not to drink soda, or your dentists have told you not to eat sugar, because they also lower your pH and cause bacteria to grow exponentially. Excuse me, guys. And the last one is accidents. So, obviously, if you're drunk, you're more prone to accidents. And half of our emergencies are someone who falls. So that a lot of those accidents could be prevented with alcohol. On your overall health, again, it causes cirrhosis of the liver, cardiovascular disease, and various cancers.
So we do have a question in the chat from one of our participants.
Sure.
So I won't say their names because I know they have a little anecdote that I'll read out, but they said, what influenced you to go into the field of dentistry? Is it your passion for oral health or other factors that make being a dentist desirable? And they preface it by saying that they're only a freshman, but they're on the edge of staying as pre-dental since they find comfort in the field and the convenient lifestyle it has, but they're afraid that they won't enjoy the work.
So I actually was pre-med, and I actually got into dental school with my MCATs at the time. I had to take the DATs, but they came after my acceptance. And the year that the first year I didn't apply, and then the second year, my father kept saying, for the same reason, he said, be a dentist, it'll be less stress, you have more flexibility with your family. But I didn't tell him, but I secretly applied to dental school. And my first interview for dental school was at Tufts University. And I don't know, I never ended up going to Tufts, but they sold me. I was like, wow, this is like, you're dealing with health, and you're dealing with, it's very artistic, And you know, when you're working, we think a lot of times, unfortunately, dentistry is seen cosmetic, but you there's some life altering changes you can make to people um, by improving their oral health. So anyway, at the time there were two dental schools, Columbia and Harvard, who had the first 2 years where the medical and dental students were in the same classes, and then you break off after the 2 years. So I thought, oh, okay, I'm gonna, you know, they really believed in the whole connection of oral health and overall general health. So that's basically how I got into it. I think it's a great career. I love what I do. You're one-on-one with patients. You can really affect their health. Many times I've helped diagnose things in people and get them early prevention to their physicians. So and also, you know, the cosmetic part of it too is so fun too, because you transform people. If it's something that's really important to them, it gives them confidence, makes them feel better about themselves. Basically, that's, I hope that's answers her question.
Yeah, thank you for answering.
Okay, so the next one, diet. I want to tell you another thing that I've incorporated hugely in my practice is diet. I actually own two weight loss centers too because of this. Because I feel like, again, on your oral health, it's dental caries, tooth decay and loss, your general health, all these. Everything but cancer is 100% preventable. Well, cardiovascular disease, not if you have valve disease. But if you have high blood pressure that leads to blockages, 100% with diet, obesity, 100% with diet, diabetes, 100% with diet. Not diabetes 1, but diabetes 2 is 100% preventable with diet. So I love to show this to people. In 1905, sorry, I need to update my slide. In 1905, the average North American had 5 pounds of sugar. And I know the recent 2020. So what do you think it is? Any guesses
Oh,
in the chat?
I feel like someone said 10 pounds, someone said 35,
Okay,
10.
you guys have to keep going higher.
Oh, okay.
It's
40,
pretty
50,
scary. So it's
50.
172 pounds. And you know, you can't make this stuff up, so you can look it up. But like, I mean, I'm not going to tell everybody to get off this class and I mean this call and be a hunter and gatherer. But I always say it's the middle aisles of our supermarket. You know, everything we want, long shelf lives. We use preservatives, even our toothpaste. And that's how much sugar we're getting. So these are not obese people. We are getting 172 pounds. So I don't know how much science background you guys have, but every time you eat sugar, your pancreas releases insulin. What do you think diabetes type 2 comes from? High cholesterol comes from, and high blood pressure. This is our problem. So this is, if you're a physician, if you're a PA, if you're a dentist, you need to take this seriously. And obesity in our you know, nation, this is what's happening. So this is just showing average consumption. Of course, the US is up there, but if you look, one of the lowest is China. I don't know if they're just not giving them food or what, but at least, you know, they are so much more ahead of us. So look at the world's consumption of sugar, how high it is. The dark blue is basically the high consumption, and you can see it's mostly dark blue. I mean, some of the Middle Eastern countries are lighter, and I think that's because they're still forcefully organic. They haven't had sort of the capitalist, like people are still getting their yogurt in a bucket. They're not going and buying, you know, yogurt that can sit in the refrigerator for a week. And okay, strategies for improving oral health. Make sure everyone has access to affordable fluoride. So fluoride has been the single most preventive measure. Adding the fluoride in the water was the most incredible thing they ever did. It should be all over the world. Giving people in-home and professional hygiene maintenance, just educating them. I've been on a few mission trips, just educating people. You won't believe how many places in the world there are people who have never seen a toothbrush. We take it for granted here in the United States, but there are people who don't even know what a toothbrush is and why you have to do that. And nutrition. So I think you do these three things, that you are, these are the three most important. Of course, there are others, but these are the three most important. We talked about basically the shared risk factors of oral health and general health. I hope you are all convinced now that there is a link there and you can read more about it. I didn't get it too much into detail since this is just a very introductory level presentation. When they developed oral health programs and general health programs, the problem is they're separate programs and they should be linked. These are programs in all the countries that we go and help. We're not linking these together, and we're either redoing work that needs to be done. We need to collaborate better because, again, education and preventive programs, we go in when it's too late, when people already have all the diabetes and chronic diseases, and it's really hard to help at that level. So that's what a vertical versus horizontal approach is. Like, stop going in there and treating the diseases. Let's start prevention and, basically have people from the very beginning get good practices so we don't have to go in there because it costs us a lot more money and we can't reach as many people. So that's about it. I made it shorter. Sorry. You want to go to questions? We can go to questions.
Yeah, we can start the Q&A. For those of you who are in the call, you can either post your questions in the chat or unmute yourself. I can start off the Q&A by saying, I know you have both a DDS degree and a master's in public health. What do you think is the benefit in pursuing dual degree programs or taking time to pursue a secondary graduate program?
Well, I'll just stop the share and then. You're really lucky these days because there's so many dual programs. I know a lot of people are doing like MD, MBA, which is so important because like doctors were saving lives, but then there were policies being made in DC about like reimbursements and they had no idea on the business aspect of it. So I think just having it's just like my undergrad degree too, is international affairs. I think opening your mind, it's important to have like the biology and the physics and the, chemistry and the biochemistry, but also in order to be a very well-rounded clinician, you should have exposure to other fields. So if you are able to take a dual degree, take advantage of it because it really makes a lot of difference.
Yeah, and you spoke about your BA in international affairs. What was the motivation for you to pursue, like, I guess, a non-traditional major for someone who was pre-med and pre-dental?
So, I mean, believe it or not, I have a passion for both like healthcare and just the whole, I knew I wanted to be a doctor or some sort of healthcare provider. And I also love foreign policy. I'm still passionate about it. I have also served on boards that have influenced foreign policy. So, even though I didn't pursue a career in it, it's sort of been a hobby and it's a good one because let me tell you, if whether you go into medicine or dentistry, you need that sort of mental break to do something else that you also want to, pursue. But I don't know how they are in dental schools today. I know when I was applying, they did like it when you sort of had another degree. To be honest, if I had to do it all again, I'd recommend getting a science degree and then a minor in something else because it'll make dental school a lot easier. You have a lot of catching up to do in dental school if you don't do that.
Yeah, thank you for that. So we do have a couple questions in the chat. Someone asked, so Sophia asked, is it bad if you miss a night to brush your teeth?
It's terrible. I mean, why would you want to go to bed at night with all that food and bacteria? And the other thing that'll happen again, like, when we sleep, I'm sure a lot of you wake up in the morning, your mouth is so dry. And that's what I was trying to tell you. Like, it's all about like maintaining the pH in your mouth. So while you're sleeping, your pH is now 2 or 3 and you haven't brushed your teeth. And so the bacteria is basically having a feast on all the food and that you've left behind in there. And once they get through that, they get through the enamel of your teeth. And we talked about at the beginning, you don't want cavities to go past the enamel. So Yes, brushing your teeth at night is important, and brushing your teeth in the morning is important too, because again, people will be like, well, I brush my teeth at night. Why do I have to brush my teeth in the morning? That's exactly what you do. You just change the pH of your mouth in the morning.
So thank you for answering that. I know.
It's okay. It's a valid question. And then I know people are like, your teeth, they're not even that important. Or a lot of young people your age probably don't have cavities because you had access to fluoride and fluoridated water. But you guys have to remember, fluoride prevents cavities, but it doesn't prevent gum disease. It doesn't prevent periodontal disease. So periodontal disease is totally separate. People can lose really good teeth that have never had a filling if they start losing their attachment apparatus. So you're trying to take care of your teeth and you're trying to take care of your surrounding gums and bone.
Yeah, I'm very much the type of person I have to take all my makeup off before I go to sleep and brush my teeth, or else I can't. I'll be staying up at night just like worried about it. So
So these are the three things you should do before you go to bed. You should brush, you should floss. I mean, if you don't live in an area of fluoridated water, like you have well water, you should also use a fluoride rinse, and you should be brushing your tongue. So I didn't go through my whole tongue scraper, but I think that's one of the most important things today in dentistry. And you guys go afterwards. There's a great website, scrapeyourtongue.com. And they'll even show, it's kind of gross, but the bacteria that you don't scrape off. And if you even scrape it off and you see what you're scraping off, believe me, I think it'll be part of your routine. So if you can do those three. I see a question here I'm seeing on the side about water flossers. I'm so sad, but there was a study and it was like a significant p-value, which means like the study is a valid study, and they found out that water pick is just as effective as flossing. So if you really hate flossing, then buy a water pick. And the best brand is Water Pick, WATERPIK. So it's kind of like power washing your mouth. And if you don't want to make a mess at the sink, they have one you can take in the shower and you can just water pick all over. So
so we do have a question regarding, I guess, I don't know if they're specific to dental school, but they asked, what is the most challenging thing you've experienced and what are some of the highlights?
clinically challenging or just the whole process?
Um, if the person who asked the question, you can either unmute yourself. Okay, so clinically.
Okay. What is the most challenging clinic? Well, I'll tell you a recent one I had. It was during COVID. It was when everybody shut down their practices and we were told only go in to see emergencies, some states and by the way, there's another thing. When you become a healthcare provider, I will tell you that a lot of dentists refuse to see their emergencies. And because, there were some that were working, we are now all, as a result, a lot more busy. So if anything happens, I don't know if another pandemic will happen in 100 years or whatever, always remember that you have made an oath to provide this care, and there's always ways to protect yourself. Anyway, I got a call at like 7 p.m. on a Saturday night. Somebody had flipped on their bike, and this poor guy had gone through braces and implants and fixed all his teeth. And he basically he broke his, and he was in front of an emergency room doctor's house. ENT came, a hygienist happened to be walking her dog, and they're all looking for the tooth in the dark. And basically, he had broken 3 teeth, and one had completely come out avulsed. And I got a call because you have 1 hour to get that tooth back in. And if you don't do it within an hour, this is where the emergency rooms fail them. They start giving them all these things and they don't get to save their tooth. And that's a front tooth. So we got him back in the office. We put the tooth back. Believe it or not, we didn't even rinse it because we put it back because we wanted the blood supply, everything, and we bonded it. And we've now saved his teeth. He does have root canals on 3 out of 4 of them, but the tooth that came completely out looks great. And so that was a fun case. And I think like most challenging, I also say is, or maybe most sad, is when you have to diagnose oral cancer, because oral cancer really doesn't have a very good prognosis. So those are challenging times in the practice. If you want non-clinical challenges, dealing with insurance companies. And I think if you hear from physicians or dentists, and we're a little better off right now, but it's really tough. It's not something they teach you in dental school, and it's really challenging because you want to sit there and provide the best care, but you also have to pay attention to all those factors.
Yeah, I work as a medical assistant, so that's probably the number one complaint from the doctors I work under is the
Yeah, so yeah, and I don't know who decides these reimbursements, but I tell you, I mean, we just want fair reimbursements. Sometimes like you're not even noticing like, and I now have more time because my kids are older, but there are like insurance companies who are paying you less than you're paying your staff and your overhead. So basically you're paying out of your pocket so somebody could come for their preventive dental cleaning. So that's where it's not a matter of greed, it's a matter of just being fair. So
We have a question from Alanud. I don't know if I said your name correctly, and I'm really sorry if I mispronounced it, but they asked, "What does a typical day look like for you, and how do you time manage?"
um so since COVID, the typical days got, we don't even have lunch in our office because I have a lot of working moms and everybody prefers to go home. But I don't know if you guys have kept up with it, but like the COVID regulations are so much more strict than they were before. So we can see a lot less patients, which means we have to work more hours. But I get in at 8:30, no lunch, probably leave around 4:30. I have a hygienist who has a full day of cleanings and hygiene, and I do exams for every one of hers. And then my day is all mixed. I have fillings, I have crowns, I have extractions. So as a general dentist, you can do a lot of things. And then but you also have to check your every hygiene patient. So that's a typical day.
And we have a question from Myrna. Should we use mouthwash and toothpaste, not just one over the other? And if so, do they differ?
You know, that's a very good question. But again, that really also, oral health depends on the individual too. Also, all mouthwashes are not made equal. Like if you have periodontal disease, you might need an antimicrobial mouthwash. If you are more prone to cavities, then you need a fluoride mouthwash. And so that's why it's really important. And some people don't even need a mouthwash. Like you have great access to fluoride, just brushing twice a day with a fluoridated toothpaste and flossing. That's it. That's all you need. So it also like it's not one formula fits all. Like that's why you should go, and if you have a very good oral health care provider, they will tell you what's best for your situation. A lot of older patients have dry mouth syndrome. A lot of these medications we take, they're great, they solve one problem, they cause another. So then we have to teach them how to manage their dry mouth. So that's I hope that answered your question.
Yeah, thank you for that. I have a question regarding some of the research that you did. So, why did you decide to research on the effect of menopause on periodontal disease and the presence of oral pathogens in children and women diagnosed with AIDS?
So when I came out of dental school in 97, we still didn't, AIDS today, like it's kind of like COVID. Everyone thought they were going to die of AIDS. Um, there were the antiviral cocktails we have today that are saving AIDS patients. AIDS used to be a death sentence. It no longer is. So we were trying to find out, and patients who get AIDS get something called ANUG. It's terrible. They're like, what, wake up. Sorry if it's anyone, I mean, you guys should be able to handle blood because you want to go into, but they wake up and their whole pillow is basically filled with blood. So, and again, that's because they were so immunocompromised. And later we find out once you treat that, and you also, if we would help them like by doing a really good cleaning, then we would aid in decreasing that problem and it also improving and supporting their immunity. The problem is nobody wants to see AIDS patients. So I was pregnant with my first child and I was doing a rotation and I decided to treat AIDS patients. The next thing I knew, I had lines of people. Oh, there's this resident, she'll treat AIDS patients. And I remember being pregnant and I said to my husband, no, I hope you think it's okay, but he's also a cardiologist. So he said, look, we went in this field, we're protecting ourselves. You know, we took an oath. You can't turn away. So anyway, that's why I did the research there, and that was at Columbia University. So I was working with all these AIDS patients, and the menopause comes, that is one of the reasons I learned later that women who go through menopause have a higher chance of having heart disease. But guess which women it was? It was women with menopause and periodontal disease that had a higher risk of having heart disease. And and all through your life, women's hormones will affect their gums. We have pregnancy gingivitis. We have women through their monthly menstrual period. We'll have, you'll see different effects on their gums. Menopause, again, we get more prone to bone loss. But again, if you have good oral health, none of those things happen. You can prevent the effect of the hormones if the mouth is bacteria free. If there's bacteria and there's a hormone change, there's where you're at risk. So
Just another thing we got to deal with as women.
exactly. It's so fun being a woman.
So I know that you incorporate nutritional health in your day-to-day practice. Is that something that you see in a lot of other dental practices, or is it something that needs to be implemented more?
Well, no, we don't see it because A, it's not reimbursed. So unfortunately, like, time is money and people have to take the time to give that nutritional advice. But of course, we're anti-sugar and we bring, the importance of not drinking soda, not eating. But I actually feel like the obesity rate is so high, and I do believe in ketogenic diets. And so I do have a program where people can come sign up and get coached and come weekly and have accountability. So I incorporated it, and I think more dentists should talk about it. I definitely, with my kids, they all know, and I think now they go prepare for it. I'll ask, what are your three healthy snacks? And when I hear people say, you know, what are the candies, gummy bears, then I know that there's a problem. Okay. But kids are honest and innocent. And now they'll all come back and tell me like these exotic vegetable dishes. I'm not sure if they're eating them for snacks, but I get some great questions after that first appointment. So yeah, that's every kid that comes in. We end it with, what are your three healthy snacks? Even if I can teach them from an early age to incorporate the, vegetables and fruits, then I think I've made a difference.
Yeah, thank you for answering that. We have a question from Myrna again. Is it true that pregnant women can lose their teeth?
It is not true at all if they didn't have active disease. But if they have any sort of disease in their mouth and they get pregnant, it exacerbates the situation and causes them to lose the teeth. But no, if you have a healthy mouth and you have preventive care, like if you hadn't have a cleaning in 10 years and you get pregnant and you have active periodontal disease, then yes, the periodontal disease is going to get a lot worse and your teeth will get loose. But the pregnancy itself did not cause you to lose your teeth.
So I know you have the mantra that healthy mouth, healthy body. What do you believe could be done better to implement preventative oral health measures for people who come from a low income who might not have equal access to dental and medical care?
It's a really good question. So now we're going to get really political. So, I do believe in healthcare for all. I don't think, I think it's, I always like to give the example, people think, oh no, healthcare for all, it's socialism, but it's kind of like education. We give everyone has a right to education. Everyone should have a right to healthcare. Now, if you want to send your kid to a private school or a private university, you can do that. And I think that comes with healthcare too. If there are people who still want their own private healthcare, they can do that. But we really need to give access to healthcare to everyone, including oral healthcare. I strongly believe that. And I think that it'll save money for everyone overall, because a healthier nation, we also put a lot less, healthcare dollars, and it's just, it's better for everyone.
Yeah, thank you for
And
answering.
it's just, we go into, all of you go in to become a clinician, a doctor, a dentist, because you care, and the humanity side of it is important too. And so yeah, I think healthcare is a right, both oral and general healthcare.
Yeah, I think Germany follows that model where you can either opt for the private healthcare or the public.
Yeah, I think it's inevitable for the United States. It's really a nonpartisan thing. Even Mitt Romney, the healthcare that he had developed was the one that sort of Obamacare was based on that. So it's not really a Republican or Democrat issue. We're just at a point in, that we have to do something about it. So we'll figure it out. We always do. That's the good thing.
So we're going to take two more questions. And while we wait for people to type in the chat if they want to ask the question, I'd like to ask, so I don't know if it was a gap year, but I know that you took some time to work as a research assistant. Would you recommend that students also take a gap year? And what was the goal for you when you took that time off to be a research assistant?
I worked at Walter Reed, and my understanding is, and you guys correct me if I'm wrong, that it's a lot more challenging these days to get into dental school or medical school right from undergrad. They actually want you to have exposure. Um, a few people that I had intern in my office, they did get into dental school, but it looked like they either got physiology degrees or they seem to have done something in between or worked on healthcare policy on the Hill. I know a few that got masters, a few that worked different jobs. So I think people are just looking for people with more experience these days. I think all the graduate programs, not just medicine, dentistry, law school, they're all looking for a little experience, business school, before taking kids out of undergrad.
Yeah, I think it has to do also with just the population growth. That there's a lot of people competing for spots, but
Yeah,
it
it could be, and I mean, and it's also unfortunate because like already dental and medical school is so expensive. And then I see these people like also pursuing 1 year or 2 year master's programs, which adds to your expenses to get into medical or dental school. But my understanding is, and maybe I'm wrong, that a very small percentage are getting out right from undergrad these days. But work experience is good too. The good thing about working is it helps you decide whether this is something you want to do. Because I tell you, 4 years of dental or medical school is very challenging, and it requires a lot of discipline and hard work and commitment. So if you sort of expose yourself to some sort of healthcare field, you'll confirm that you're willing to do all that.
Yeah, thank you for that. We have a question from Carmen. They asked, what value did you see in research for furthering your career?
I think it's research, and you have to like it, but I think just finding connections between and how you can improve the delivery of oral health by learning more about, cause and effect. I would love to do more research now, actually. I was thinking of ways to start it, but it's a lot harder when you're not affiliated with the academic institution. And my husband and I moved here in 2000. So once we moved away, even when I was in Pennsylvania, I could still go back to Columbia University. But the closest dental school here is University of Maryland, which is like an hour and a half away. So, but you really do need to be affiliated with a sort of academic institution to pursue the research. But see, again, that's a great thing about you can have a private practice, you can teach a week. I mean, this career has a lot of options. So,
Yeah, thank you for that. I know that must be difficult though, since I know you want to pursue the research, but hopefully you find a way to do that because I think it's really great what you do with your patients. So I'll wait a few minutes, or not a few minutes, sorry, about a minute to see if anyone has any other questions. And if not, I can, say the closing statement.
how many students here are mostly juniors, seniors, or just a mix? You don't know the demographics of the students?
It depends on who's in the chat, I guess. So we have a senior. I know I'm a junior, and
Oh, freshman, everyone's answering. Okay, great. That's great. We have a good mixture there. So the seniors should have already applied by now, correct? I don't even remember this process. It was such a long time ago. Seniors,
I'm one of the seniors who answered. I just took my MCAT, but the application cycle opens up in June. Oh, well, at least for me, because I didn't apply my junior year. I wanted to take a gap year after to do some research.
so when you apply for June, you'll be admitted for 2022, correct?
Yes. Yeah.
Okay, so got it. What are you doing in your gap year?
I do research at Wayne State School of Medicine on cells and bacteria and bacterial vaginosis. So I just wanted to kind of do more on that, hopefully get published soon. And I just wanted to keep working because I do scribing at an emergency department. So I wanted some more hours.
Well, that's great. Those two things together would be great.
Thank you.
Actually, the person I know who did the health policy, he was also a scribe, and he took a year or 2 years off, and he just started at Wake Forest Medical School. So
Wow, that's awesome. Hopefully we can get in after this.
you will.
Thank you.
yeah, that's a good school in North Carolina, correct?
Yes, in North Carolina.
I've been like trying to scope out my list of medical schools. So
That's a great school. I mean, NYU is a great school, and the great thing about that is you won't pay any tuition.
they have a 3-year MD pathway too. So that's one of the things I was looking into. If no one has any questions, or if you guys want to ask questions, I don't know if you can stay on for a little bit longer.
Sure.
All right, well, thank you so much for the incredible and insightful session, Dr. Yazdani. I really enjoyed how interactive and encouraging you were, and I hope to have a session with you again in the future. If you would like to post your social media handles or links to your business endeavors in the chat, please feel free to do so. And to our WSU students, please make sure you complete the Google survey posted in the Zoom chat summarizing this session to obtain your shadow hours. Thank you all, and I hope you have a great night.